So my name is Halkeno. I work as a refugee health program director for EMBARC.
And my name is Mallory Petsche. I am our family-focused program manager with EMBARC. EMBARC, we opened our doors here in Waterloo in 2014, which is actually thanks to a grant from the Community Foundation. So we're incredibly thankful for your support. That first grant, it funded a really small pilot project focused on women empowerment using our Navigator model. So that's really how we got our start here. Our mission is to improve the world of possibilities for refugee families through advocacy, education, and community development. We focus on health programming and then also family development. So on the family development side of things, we're really focused on early childhood development, youth development, parenting education, and then also workforce and economic opportunities, because it's really important to make a family strong to be able to have all their basic needs met.
So the health program, actually, we do have two kind of approach where we are directly working with the community members in terms of helping them understand, get some awareness related to health issues, because people, when they change a country, they change their diet habit. So that is very important for people to understand what is healthy eating and what is not healthy in their new homes. After we help them to understand all the health concepts, health-seeking behaviors and those kind of things, and then when they get to the providers, they have so many challenges in terms of the cultural barrier, the language barrier. So for that, then we have what we call it medical interpreters that are working with providers in a medical clinical setting. So EMBARC got a fund from the foundation to develop a curriculum and then train those workers on those curriculums based on different competencies.
We primarily serve the refugee community from Burma. EMBARC was actually founded by refugees from Burma from all different ethnic groups and communities that wanted to come together and help create a better life for their community and for their children. So when individuals, they are resettled to the United States, there is typically a 90-day resettlement period where families get the help of a caseworker. But 90 days is never enough to help individuals learn the language, learn the culture, learn job skills, access education. And so it can be very difficult for these families to support their children while also accessing health care, and a lot of times also the trauma that they've experienced with the nature of being a refugee. There's not a lot of care given to those when they come over here. And I know I feel truly honored to work for an organization with this mission and value of empowerment for the community, and have seen just all of the wonderful things that this community has brought to Waterloo. And we've really seen the Cedar Valley step up and be so welcoming to us and wanting to partner and support this new community. And we're so lucky to live in such a great place. Mm-hmm. Halkeno?
Yeah, I really appreciate that part, how community is really very open to. You hear so many times, every single day almost, just people say, we really want to get engaged, and then we don't really know how to engage. The language and the cultural barriers are there, and then they ask, what is the best way of getting engaged, getting connected to this community? And just like Mallory was saying, that is a huge part that we really appreciate every single day.
The grant that we received, it's really for a two-tiered approach. So on one side, we're working on a community needs assessment, really focusing on the workforce and barriers to members of the refugee community getting jobs, and really narrowing in on how childcare affects that. And then on the other side, we're working on, we have a walk-in clinic for social services where individuals are able to come in and get their needs met, and also gain skills for employment, fill out applications, and learn about different job opportunities. And EMBARC, we're really trying to build that foundation and services for the Burma community, but also all the other refugee communities, and to build partnerships with other mainstream organizations to make those services accessible. I'm just so thankful that Waterloo is dedicated to becoming more welcoming and to working on expanding their services and to make it so families here are able to get care that they really need.